is CNN Breaking News.
Breaking news just into CNN. The Congressional Budget Office has just released its score of the Senate GOP health care bill. The headlines, listen to this, 22 million more Americans would not be insured under this bill by the year 2026. The CBO also estimates this version will reduce the federal deficit by $321 billion by the same year, 2026. I want to go right now to CNN's Phil Mattingly. He's on Capitol Hill reading the report as we are. What more are you learning, Phil, as you look at this?
There's a couple interesting things to dig out here. Obviously, the top line coverage number is something that everybody pays close attention to, and notably, Senator Dean Heller of Nevada, Senator Susan Collins both said that's a key number they want to keep an eye on. But you got to dig a little bit deeper too. And one of the key things here is deficit reduction. According to the CBO, $321 billion over the course of 10 years. The Senate bill mandatorily, Jim, has to save $133 billion. So what does that mean? That means that they've got $170 billion to work with there in terms of using money, using financing, possibly for Medicaid, possibly for other issues, to try and get senators back into the fold, some wary senators. I also want to talk about premiums. Look, when you talk to conservative members here in the U.S. Senate, the thing that they care about more than anything else is premiums. How will cutting back the Obamacare regulations affect premiums? And while premiums will go up in 2018, 2019, when you dig in a little bit further, in 2020, premiums would drop by an average of 30% for individual plans. By 2026, 20% for individual plans. So while the top line number on coverage is certainly something Democrats are going to seize on, Republicans are not going to appreciate. On the premiums, that is some news that I think Republican conservatives will be really interested in, no question about it. So there's a lot to take away from these numbers. Top line, difficult number, but when you dig deep into the policy right now, both on the budget savings and on the premiums, you could see some positive news that you're certainly going to hear Republicans talk about going forward. Jim, I think one of the interesting elements here, obviously, is we talk about the politics, we talk about kind of the dynamics, the inside baseball. What actually matters here on the policy? And you look at these coverage numbers and you talk about what's actually in the bill compared to the Affordable Care Act. The Affordable Care Act expanded Medicaid for 32 states and the District of Columbia. That covered 10 million people on its own. This will phase that out starting in 2021, so that would disappear over time. You also have abortion funding. Planned Parenthood would be defunded for a year. That is a major issue for certain senators. Obviously, Democrats are very upset about that issue as well. One of the interesting elements here is you try and figure out how they would kind of shift over the Medicaid expansion population would be the tax credit, how the tax credit is structured in this bill itself. It's very different from the House provision. It's very similar structure to what they had in the Affordable Care Act, though lowered in terms of eligibility based on the current poverty rate. And the idea, according to Republican senators, is as you kind of close out the Medicaid expansion population, that tax credit would be in place to help pick up that coverage area. This CBO report seems to imply that, at least according to CBO standards, they don't believe that would happen at the rate that Republicans hope it will. That will be a point of contention going forward. But that's how, when you try and take apart what the policy is, how it relates to these numbers, and then politically what that means going forward, kind of this all wraps together. We're going to have to get some reaction from senators to see where they stand on this, but a lot to take out of this kind of in every side of the spectrum, Jim.
Phil Mattingly, thanks very much. Joining me now to talk about the GOP bill is GOP Senator Bill Cassidy. He's a Republican of Louisiana. It's also worth noting he's a doctor who's provided free health care to the uninsured in his work. Senator, thanks very much for being here, and fantastic timing. First of all, and I realize you're reading this as we are, but we do know those headline numbers. 22 million will lose their insurance by the year 2026 with savings of $321 billion overall from the federal deficit. Your response to this score?
I don't quite understand it. For example, premiums are predicted to go up next year, even though we're throwing an additional $15 billion at it. I think I'm told that's because they anticipate the risk pool getting bad. The risk pool is already terrible. So I'm not quite sure I understand that. Secondly, as regards the uninsured by 2026, one thing that has been in the Susan Collins Bill Cassidy bill, the Patient Freedom Act, is automatic enrollment. And I don't think they modeled automatic enrollment. If you automatically enroll people, you're going to have more folks in the pool than if you have a mandate. That has not been, I'd like to see that modeled as well.
Well, let me ask you this. After the CBO judged that the House version of the bill would leave some 22 million people out of, actually 23 million people, you called that bill unsupportable. You said you wouldn't support it. So after seeing virtually the same projection here, will you refuse to support the Senate version as well?
Well, I have to read it first. I mean, I'm looking at a headline. But the reason I find it curious, whereas for a 62-year-old man, he making $20,000 a year. Under the House bill, he would have paid $13,000 a year for his insurance. Totally unaffordable. Under the Senate bill, he would pay $800 a year. $13,000 to $800. Now, clearly, that is a more affordable policy. So why do the coverage numbers not move that much?
Are you saying you don't accept the CBO scoring of how many people would lose their health insurance under this?
I'm just saying I have to understand it. I can't comment on something before I understand it. And when you said perfect timing, not quite, because as I was walking up, it came out the CBO score had been released. I've not read it yet.
Fair enough. We do want to give you more time to do that, but I do want to get to what the defense of this bill has been so far. To address the high health care costs, this bill does make cuts to Medicaid, allocating less money to Medicaid. Yet over the weekend, Kellyanne Conway, of course, spokesperson, surrogate for the White House, made a remarkable claim that there aren't any Medicaid cuts in this bill. Is the GOP misleading Americans about what's actually in this bill?
Kellyanne Conway is not the GOP. I can speak for myself.
She's a very close spokesperson for the president and speaks for the president.
I just can't address that. I can address what you raised. There's three aspects to spending less on Medicaid. One is that people would move off of Medicaid onto private insurance. That's actually a good thing. If you can preserve the private insurance market, that's a good thing. Secondly, there is a cut in the rate of inflation. That does not actually occur until 2025. And so the spinach, if you will, is postponed, giving an opportunity to see how this plays. And the third way is that the Medicaid expansion begins to, the amount of money the federal government puts towards that begins to decrease. But my point all along is that states cannot afford the money they are already obligated to put up. In California, it would be $2.2 billion a year by 2020 for the Medicaid expansion. My state, much smaller, $310 million. Both numbers very hard to cover. Right. Now, by the way, I've not committed to voting for this bill, but I do think it needs to be addressed fairly.
From what you can see here, listen, I want to give you more time, but your experience is material to this. You're a physician. You've served in a hospital, helping a community clinic, rather, helping people who have trouble affording health care, getting health care. When you look at this bill, if one of them came up to you and said, is this bill going to make it more or less likely for me to get health insurance, what's your answer to that?
It makes you more likely to get private health insurance. I mean, because right now...
Affordable private health insurance? Because it's clearly taking money away from the Medicaid system, which is how millions of Americans are able to pay for their health care.
So if you recall, I said that the 62-year-old making $20,000 a year, $20,000, which granted would not be Medicaid eligible, but it's in the ballpark, his premium would be $800 a year. And so you're right. There might be somebody who's on, if things are totally free, as opposed to someone who has to pay 1% or 2% of his income. That said, it also has to be sustainable. And that's one thing I've learned working in a public hospital system for the uninsured. You can have the best plan in the world. If it is not sustainable for the taxpayer, that plan will not continue. And so we have this tension. How do we make sure things are affordable, both for the taxpayer but also for the patient? That's why I need to read the report. And I don't mean to defer. I just have not read the report yet.
I understand. And you're describing the actual tension right there. At the end of the day, yes, bills like this, or actually rather Obamacare did insure more people, but essentially the Republican argument is that the cost is too high, is it not? I mean, are you saying in effect that Republicans are willing to insure fewer people to save money at the end of the day, saying that we can't as a country afford Obamacare or ACA or whatever you want to call it as it stands? Is that the essential argument?
I'm not saying that at all, because when I spoke of automatic enrollment, if you have automatic enrollment, as we do on Medicare, where when you turn 65, you're automatically on Medicare unless you call and say you don't wish to be. We have like 99% of those 65 and above on Medicare. If a state decided to do automatic enrollment in Medicaid for those eligible, and in the exchange population for those eligible, you would have 95% folks eligible enrolled. And that actually would increase your, frankly, increase the amount of money you're spending, although lower on a per beneficiary basis, and it would also increase your number of insured. So I want to see everybody insured. I think actually the automatic enrollment feature, which we are proposing, Collins and Cassidy, is a more effective way than the individual mandate.
Final question for you, and again, I know you have to review this word for word, but just based on what you've seen so far from the CBO score, does it make you more or less likely to vote yes on the bill?
It makes me more concerned. I've been uncommitted, and I remain uncommitted. I mean, just deadline uncommitted. But it certainly makes me more concerned and makes me want to explore this more.
Senator Bill Cassidy, we appreciate you taking the time, and we know you're just looking at it, so we take that to account as well.
Thank you.
Coming up, more on the breaking news. The CBO estimating 22 million fewer Americans with health insurance by 2026 under this current version of the Senate health care bill. We're going to talk more about that right after this.